This message is addressed to the legislators of the government of Puerto Rico. Puerto Rican military optometrists serve with honor, discipline, and proven clinical training. They have met national standards, passed the national boards, and demonstrated their competence in high responsibility settings. Their work consists of caring for the visual health of active duty military personnel, retirees, veterans, and their families. In the Army, the Navy, the Air Force, the Coast Guard, the United States Public Health Service, the Veterans Hospital, and in all 50 states of the United States of America, as well as in Washington, D.C., Guam, the United States Virgin Islands, the Northern Mariana Islands, and American Samoa. They are fully recognized with the authority to diagnose, treat, and prescribe medications for eye diseases. However, in Puerto Rico, this authority is not recognized. This contradiction is unacceptable. Puerto Rico requires the same training, the same exams, and the same professional rigor. Nevertheless, when it comes time to recognize the therapeutic authority that these requirements validate throughout the nation, it is denied. The training is recognized, but not the practice. The credentials are recognized, but not the clinical authority. The sacrifice is recognized, but not the full exercise of the profession. This situation does not represent progress, coherence, or justice. It represents backwardness. This backwardness directly harms the people of Puerto Rico, particularly veterans, retired military personnel, and military families. The existing contradiction in this matter harms both the elderly and patients who require modern, prompt, and comprehensive visual care. The evidence of this contradiction is manifested within Puerto Rican territory itself. Just a few meters from the Puerto Rico capital, an optometrist with a therapeutic license from a United States jurisdiction has the authority to prescribe medications at the Coast Guard base, and just a few miles away at Fort Buchanan, at the Muniz Air National Guard base, and at the Veterans Hospital. Within the federal system, this authority is effective. Outside of that system, according to Puerto Rico legislation, it is not. It is the same person with the same academic background, the same professional experience, the same clinical ability, and operating in the same Puerto Rican territory. However, there is an authority within a federal facility that disappears upon leaving it in Puerto Rico. This situation lacks scientific, clinical, and moral justification. It is imperative not to forget our active military personnel, especially in times of international tension, as well as our veterans and their families. Those who serve the nation deserve the assurance that in Puerto Rico they will receive the same level of visual care as is offered in any other jurisdiction of the United States of America. Puerto Rican military optometrists, just like their civilian colleagues, are not asking for special privileges. On the contrary, they demand professional respect, legal consistency, justice for patients, and the urgent modernization of optometry in Puerto Rico. Puerto Rico cannot persist as an obsolete exception. Puerto Rico cannot continue restricting duly trained professionals. Puerto Rico cannot keep denying its population the contemporary standard of ophthalmological care. It is imperative to rectify this contradiction. It is imperative to modernize the current legislation. It is imperative to take immediate action. Optometry in Puerto Rico is stuck in the last century. It's time to bring it into the 21st century.